I think we can begin by calling the roll, please.
All right, Kim Barrett,
Present.
Dan Bernal, George Blumenthal,
Here.
Maria Bonneville,
Present.
Anne-Marie Deliege, Elena Flowers,
Present.
Judy Gaston,
Here.
Vito Imbassiani,
Here.
Stephen Julesgaard,
Present.
Pat Levitt,
Present.
you, Linda Malkus, and Adriana Padilla. Adriana should be joining momentarily. She's computer issues, as you suggested.
Great.
Yeah.
Okay, so the first matter on our agenda is the discussion of management's response to the performance audit presentation. And I believe Raphael is going to give that presentation.
That's right. Thank you.
Anybody come?
Yeah. They called me.
Claudette's about to
Yeah.
flash the presentation. Thank you.
Okay, so the first matter on our agenda is the discussion of.
Okay. All right. Thank you. Again, my name is Rafael Aguirre Sacasa, and I'm the General Counsel for CIRM. And on behalf of management, I'll be presenting today's management's response to the 2023 performance audit. And as you'll see, some remaining items that are open from the 2019 to 2020 performance audit. Thank you. As always, we start off with our mission statement, which is accelerating world-class science to deliver transformative regenerative medicine treatments in an equitable manner to a diverse California and world. Thank you. As I mentioned, we're going to be going over two things today, the 2022 to 23 performance audit, which was just completed, and there was a presentation on the 25th by Moss Adams, and some open items again from the 2019 to 2020 performance audit. One thing that I'd like to comment here is that management is committing to returning in 6 months and giving an update to the Governance Subcommittee as well as the ICOC on progress with respect to all these open items until we close them all. So just wanted to confirm that for you. Thank you. A couple of quick highlights. We didn't have any compliance findings in the 22-23 performance audit. We had, whereas in the 2019 and 2020 performance audit, we had 3 compliance findings. So again, that's a little bit of pat on the back for CIRM and the management team. Thank you. And we'll start off with 22-23. The first, we'll do a page flip here. Go finding by finding and go over the proposed action by CIRM. Again, the first finding was that at the time we had 11 staff members reporting to the CEO versus a standard industry standard of 4 to 6. Moss Adams saw that as could be stressful on the executive role, and so they suggested exploring organizational options to reduce the CEO's direct reports. That is being done currently by the interim president and CEO, JT, and he's looking at the leadership as well as CIRM as a whole. Okay, thank you. Number 2, the Moss Adams noted that the ICOC is comprised of 35 members and that meetings are held in a hybrid environment. They noted that these could present potential risks to full board engagement and productivity. Recommended that we regularly assess our hybrid meeting practices and that we leverage our committees and working groups. As you know, we do leverage the work of the subcommittees and the working groups, and we use that to provide robust policy analysis and developments, and those efforts obviously continue, for example, here. We're also going to work with the board governance team to conduct an engagement survey of the board and identify specific areas for further engagement between us. We're also paying extra effort right now to post-COVID in-person engagement by having 5 in-person meetings a year, as well as providing the opportunity to engage with the CIRM team outside of such meetings, and we encourage you to do that. One of the things that we've tried to do, or we've been doing, is to provide greater transparency into what we do. is to work with board governance to create a series of small group primers, if you will, on key policies and activities for board members. We did an IP policy development primer last year, and we felt it was well received, and we thought that it was a good way of helping identify things we're working on to the board members. And please, obviously, if you have any questions, stop me at any point. That goes without saying. Again, our sole source procurement process complied with our policies, but there were some system limitations with the fiscal where we report our contracts, and that resulted in us reporting these sole source contracts inconsistently. The recommendation was to develop a process that would consistently record the sole source contracts in fiscal. We took the action. We consulted with fiscal directly, and we worked out a process where the finance team has agreed to use one code where consistently where source contracts are recorded. So that will solve the issue here with fiscal in our mind. We also do, as an FYI, as a reminder, probably, we report and disclose all of our contracts to the board on as part of our contracts reports process. We don't identify sole source contracts as such currently, but we will be doing that moving forward so that you know which contracts are sole source versus which ones are competitively bid. Okay. Thank you. Under our loan election policy, which is contained within the grants administration policy for CLIN projects, there's an outdated reference to LIBOR. The recommendation was to replace LIBOR with the secured overnight financing rate. The good thing is that we're not violating any rules or regulations at this point. We actually have the ability under the GAAP to use another index if it's stipulated in the notice of award. And so we have been doing that, and we're using the secured overnight financing rate in these NOAAs instead of LIBOR. And when we have the opportunity, which is in the plans for this year, we are going to revise the grants administration policy to change LIBOR to SOFR, but also make some other changes as well to the grants administration policy. And obviously that will be presented to the board for approval before it goes through the Office of Administrative Law process. Okay. On this one, I just want to note, this one is also tied to a finding from the 2019-2020 audit. We'll talk about that one. That's slide 21. They're sort of tied together, and our response has been more or less the same. Again, the finding was that our monitoring of compliance with technology disclosures was ad hoc, and it could create a risk of non-compliance and negatively impact our revenue sharing. I want to take a step back and talk about the disclosure surveys here. When we discussed this issue with Moss Adams, we decided that the first step in this would be to conduct an initial survey of our CLIN level grants to identify any applicant projects associated with CERN grants that had been licensed or commercialized. As you can see, we received responses in over 60% from over 60% of our grantees. We are following up with our non-respondents to increase that number. We plan on implementing the survey triennially, and we're going to include Tran awards moving forwards. On top of this, another recommendation by Moss Adams, or in consultation with Moss Adams, was to take a risk-based audit approach to go out and proactively audit some of our grantees to see whether or not they were complying with the technology disclosures. I've already spoke with Ben Wong, my deputy, and we're looking at third-party solutions and coming up with a plan of implementation for this over the next year. So, we're going to do it from both ends, do the survey side as well as do the audit side to verify. Okay. Thank you. The finding was that we're in the process of developing and launching the PSP, or the Patient Support Program, and that it has inherent uncertainty related to the financial stability of the Patients Assistance Fund, the number of patients served, and the program duration. The recommendation was that as we implement the PSP, that we would conduct regular reporting to the ICOC on the number of patients served, average cost per patient, as well as any data informed evaluation of the PSP's possible reach and duration. As noted in the slide here, the performance metrics are already a requirement of the PSP application. So we will have that data. Specific operational details will be part of the business rules and reporting processes to be agreed upon when we decide on the successful applicant. This data will be provided to the AAWG, and they will be able to provide recommendations on reach, duration, etc. Again, finding is that we collect a considerable amount of data that's valuable to stem cell and regenerative medicine research. Today, we haven't established a data governance structure to process, collect, compile, and share this data. This would obviously help our mission, and so the recommendation is to do so. And we're committing to developing a data infrastructure framework for this research data. This is going to include a full implementation of data sharing and management plan guidelines for all of our research awards, and the development and deployment of a public metadata dashboard for all CIRM-funded data. Okay, thank you. Finding number 8, as we revived our operations, leadership restructured some functions which impacted workload distribution amongst the teams. This has resulted in elevated workloads for specific groups of employees, and will continually evolve as our areas of focus continue to develop, etc. The recommendation was to incorporate data-driven workload analysis that includes realistic timelines and staffing needs. And the HR team is working with the CEO and the leadership team on setting expectations on these timelines and proper staffing levels to make sure that we allocate personnel appropriately to those areas of CIRM's focus, so that we have the appropriate staffing as well as not an overworked employee base. Okay, as you all well know, the pace of our programmatic changes and operational changes at CIRM lead us for some challenges to staff and maintaining priorities and work streams, sort of a follow-on from the previous finding. The recommendation is to adopt a standardized change management template and promote communication and accountability throughout the whole change process. Leadership is aware of this, and we're reviewing options for change management consulting, and in the hopes of identifying organizational gaps and where we can implement some best practices and training for staff on change management. And it's something that we'll obviously continue monitoring to make sure that everything is communicated properly. Okay, well, we have a few HR findings here, so you'll see them moving forward. The finding is that we had limited HR policy documentation, constrained HR personnel, and significant hiring needs following Prop 14, the Prop 14 approval, and this resulted in delayed hiring and inconsistent new employee onboarding and training. Recommendation would be to develop SOPs for hiring and onboarding to promote a consistent experience across for all of our employees, our new employees, and to differentiate onboarding plans for job-specific roles and to focus on that as necessary. As part of our refresh of our HR policies and procedures, and this will apply in a couple of other slides as well, we are standardizing and streamlining all of our processes. Specifically here, we focused on our hiring and onboarding processes. Those are the first time new employees really become part of CIRM, and we want to make sure that that's a consistent and helpful experience for them. We want to make sure that they feel confident in the organization and HR as well. In that regard, we've put our hiring process is now done via Bamboo HR, which is an online HR process. This process, the new revamped process, has reduced hiring times from an average of 4 to 6 months to less than 6 months right now. We've also started to do more pre-date meetings with our employees to go over benefits and the perks of state service, again, to try and welcome them to CIRM, to encourage them to join us if they have any questions about their benefits package and such.
Steve has his hand raised.
Sorry, Steve?
Yes, Raphael. So when looking at the finding number 11, the second part of that says constrained HR personnel. What do you take that to mean, and what actions are you taking to address that particular issue?
Sure, and again, since the performance audit was conducted, we've hired a director of HR. So we've added a more senior person in the role who has taken the lead in actually implementing a lot of these sort of online and automated processes for us. We also have another full-time employee as well as 2 retired annuitants. So 4 headcount, 2 full-time, 2 partial, if you will. And we're constantly assessing that. I think we have the right balance right now. We actually have 1 open rec for another HR assistant role here in South San Francisco, Steve, so that we can again continue to support our people properly.
Excellent. Thank you.
Okay. On this one, due to historical compensation practices, some pay inequities may have developed between tenured and new employees. The recommendation was to complete a revision of the comp policy to prevent future instances of pay inequity, and in alignment with that new comp policy, to examine our pay inequities among employees and develop a plan to remedy them as necessary. I think I mentioned this at the ICOC, but if not, we have already reviewed and revised our compensation plan. We're putting some final touches on the positional salary levels. Once that is finalized, we plan to present to the Governance Subcommittee as well as the ICOC for approval. That'll be coming again in the next cycle. It'll be the next governance ICOC cycle. So whenever those meetings are scheduled, that will be presented for your review and hopefully approved. Okay. One of the things that Moss Adams found was that our employees were questioning the efficacy and consistent application of the hybrid policy. They thought it might have hindered productivity and morale. They recommended that we evaluated our work from home policy and determined the degree to which it was applied consistently or inconsistently and whether it supported our operational goals. Considered creating a documentation that allowed exceptions to the work from home policy, but that it was consistent, but it still supported consistent application and transparency on how it was applied to across the team. We have revised. The leadership team did take this very seriously. We got feedback from the employee survey that this was a big issue for morale. And so we revised our telework policy and we implemented what we call anchor days, what the industry calls anchor days at the recommendation of Moss Adams, where we have our employees are in the office physically on the same days. Before we had we had 1 anchor day and more of a floating presence in the office. And so now we have 2 days per week where our employees are encouraged to be in the office for collaboration. And we feel this leads to increased productivity as well as increased morale and operational goals. we constantly evaluate this to make sure that there's been no loss of productivity. We'll continue to do so moving forward. Okay, now we're moving on to some open items from the 2019 to 2020 performance audit. Again, these were identified by Moss Adams, and so we just wanted to continue discussing them and see where we are on them, and we're working on them to close them out as soon as possible. Thank you. Again, when they tested the grants management process, they identified 3 exceptions to the SOP for the grants administration policy. The recommendation was to add a requirement for a separate individual to review due dates that are entered into the grants management system to ensure that there's no data entry errors and to prevent late reports stemming from these errors. As of the 3 exceptions were related to 2 specific grants under the EDUC conference grant program. And as of 2022, the following improvements were made in direct response to these. We created a conference grant progress type of report in the grants database that is approved by both the grants management team and the grants management officer and the science officer. We automated the contract amendment template to include pre-populated data from the GMS so that it reduces the opportunity for data entry errors. And then we updated the SOP with the compliance check evaluation by the Director of Grants Management on all amendments to the notice of awards. Again, this is the one I mentioned earlier. This is the dealing with the technology disclosures. The recommendation was to implement an IT control for missing documentations or reports to be flagged. Back in 2016, we tried to implement an IT control. It caused confusion and an increase in workload in our grantees, and so it did not result in the desired outcomes, which was to produce the information that we were missing. So as I mentioned earlier, in consultation with Moss Adams, we implemented the aforementioned survey on CLIN level grants to identify any projects associated with CERB grants that have been licensed or commercialized, and we're going to expand that moving forward to TRAN grants as well as the audit, sorry. Again, there was a finding that we did not have an effective policy or proactive process for monitoring and enforcing awardee publication disclosures. The recommendation was to consider implementing a customer relationship management system to support the automated proactive monitoring of such publication and press releases. Publication disclosures are required as part of our awardee reporting requirements, and the program teams are monitoring the submissions. Our policy is to withhold funds in the absence of complete reporting. We are evaluating third-party solutions to track these publications, but we haven't found one that yet fits our needs. We'll continue looking at options, and as soon as we can, we'll obviously implement that and we'll update you accordingly. So we historically relied on our scientific experts and partners for grant review. As a public agency with a mission for cures for all, it's important that we seek diverse perspectives and expertise to ensure perception of independence in application review. The recommendation was to continue to implement recently adopted practices to seek a more diverse members in the scientific community, and to monitor and evaluate our grants working group to promote a diversity of perspectives, group backgrounds, and expertise. We've launched an organization-wide DEI initiative and engagement with subject matter experts who are dedicated to assess and encourage diversity among the GWG to the extent possible. The leadership team, as well as the interim president and CEO, are reviewing our DEI strategy for the entire organization, and so that will be a focus for us in the upcoming for the remainder of this fiscal year and the calendar year. Okay. Our records retention schedule with the state of California expired in 2018. We some of our staff continue to report confusion with respect to the requirements. And this could have negatively impacted our organization's ability to respond to information requests. The recommendation was to update our records retention schedule, establish policies and procedures for records management, and to consider developing trainings to support understanding of records requirements. We're happy to inform that the Secretary of State's Records and Information Management Division provided training to staff in March of 2022. That select CIRM staff completed a records management training and certification. With respect to the records retention schedule, we sent an updated records retention schedule in September of 2022. The Secretary of State provided feedback on the initial submission. We have replied since then, and since then, the Secretary of State has provided some additional questions with respect to clarifying some definitions. We're working on doing that, and we'll submit that back to the Secretary of State as soon as we can. We hope to close this out by the time we meet next. Again, the finding was that we had 3 document management systems, and this presented confusion amongst our employees, and this resulted in inconsistent user adoption and records management practices. The recommendation was that whenever we implemented a new document management system, that we develop an adoption strategy that includes communication, policy, and procedure guidance, and accountability practices to support consistent expectations and system utilization. Just some information for you, some context, if you will. We have a relatively small IT department with 3 full-time employees, and we use some contractor partners. Our director of IT departed in the 22-23 fiscal year. CIRM delayed, and accordingly, we had to delay the implementation of a new document management system to keep other critical projects on track. For example, the build out of our HQ here and bringing the state payroll system in-house. With a new associate director of IT since November of 2022, the CIRM IT team has performed a needs assessment, piloted solutions, and selected Microsoft Office 365 to serve as an integrated document management system or platform for the staff. The associate director has built up an adoption strategy, and it will be implemented by the end of calendar year 2024. We've made significant improvements to the grants management system in recent years. However, additional opportunities exist to leverage the GMS to improve operational efficiency and effectiveness. The recommendation was to continue to identify and pursue opportunities to enhance the GMS capabilities, to automate processes, centralize data, enhance access. Again, with the departure of the director of IT, we engaged a consultant who evaluated the future of the grants management database and performed a needs assessment. This consultant recommended that we continue to use the grants management system because it's technologically stable and well integrated into our unique operations. And the consultant also provided a roadmap for evolving the system moving forward. So we have a plan for that. The software development team has begun implementing these recommendations, and it's starting with the performance improvements and enhanced reporting solutions. And we can continue to report on that as we move forward. This finding said that we host a significant amount of scientific and business data, but we lacked a strategy or system to integrate the information in an optimal way. Consider implementing a database and customer relation management system to collect and better analyze scientific and business data in support of our mission. Again, due to the departure of the director of IT, we had to delay the implementation of the CRM, as noted before. With the new associate director, we began evaluating CRM systems and solutions that integrate with our current adopted solutions. And we plan to select one by the end of fiscal year 23-24. And our goal is to complete the implementation and adoption by the end of fiscal year 24-25. Thank you.
Thank you very much, Raphael, for that presentation. And we do not need to have a motion or a vote. However, are there any questions or comments from anyone that's on the Zoom right now? It was a lot of information, I know.
Sorry. A lot of work.
No,
to do.
no, it's important and it's good plans. Okay, in that case, we can move on to item number 4 on the agenda, which is the discussion of the ICOC chair and vice chair review process, job descriptions, and the survey questions. And thank you again to Susan for all of her work on this, and she will be making the presentation now.
My pleasure. Thank you, Judy. I think we should start with the job descriptions because that really is the basis of what we're going to evaluate. So let me get, it's not letting me share. I am so sorry. Do you need to make me a co-host in order to do that?
We are troubleshooting right now.
Great, thank you. So as we're getting ready to do that for the rest of the committee, I developed job descriptions, just a first draft that Vito and Maria had a chance to go back and really edit and to see if it really fit what they're doing. And in order to do those job descriptions, I reviewed the internal governance policies, the ICOC bylaws, and the Proposition 14 provisions that related to those roles. So those were the source documents that I used.
Susan, can you check and see if you can
Mhm.
share again? And if not, we'll just have to have Claudette if you don't mind. Just
Yes. Yeah, I'm so sorry. I'm hitting share and it's doing nothing. So thank you, Claudette, if you wouldn't mind. I think we should bring up the board chair job description first. That's great. Thank you. And so you'll notice what we did. This is the responsibilities of the position. And if you want to scroll down, thank you. Now, I know we don't need to read those line by line, but if you want to just get a sense of this, I really pulled a lot of the direct language out of those source documents that I mentioned. And I don't know, Vito, if there's anything you would like to add that you changed or tweaked that you think is important.
Hi, everybody. Yeah, I suggested to Judy and Pat that 2 of the items seem to be versions of each other. I think that's been consolidated here. I had a question about number 5, which was much lengthier in the original. And it actually sort of obligated the chair to go out looking for money to support CERM's programs. And it mentioned communities, states, tribes, nations. It sounded like a United Nations effort. And this seems a lot tighter, vague enough so it doesn't obligate me to approach all of those entities, but still it puts the obligation to keep looking out for financial support for like our patients support fund. And I did have a question as to, I'm sorry about that. There's clearly, I'm sorry, somebody's at the door. Which one? It had to do, if you can help me find it, it had to do with number 7. Let's see if that's been lead the development of intellectual.
We harmonized 2 items that had to do with intellectual property into this one and recognized that there is actually a committee that deals with this.
Exactly right.
That's
So in this revised format, I think things are clear and tight.
Good. And then I see that Steve has a question.
Right, it's actually a question for Susan. So as you said, a lot of this is based on what is in Proposition 14. There is, however, one element that's listed in Proposition 14, which has not found its way into this list. And to some extent, it's found its way into Maria's list. And I'm going to read that language for you, and then I want to understand why it's not here and why perhaps it shows up more on Maria's plate. It says, this is on the things that the chairman is responsible for, to interface with the California legislature, the United States Congress, the California healthcare system, and the California public. That's the phrase. Now that was omitted or overlooked in this list. And it seems to me that's actually a fairly important role for the chairman of the organization. Those are relatively important audiences, particularly the California legislature, the California healthcare system, and the California public. So help me a little bit with why that's not included here and how you suggested that be addressed.
And I was going to say, Claudette, do you mind just scrolling down a little bit further to make sure that I didn't pick that up anywhere else? Here we go. It's item 10, engage with the California healthcare system and the California public in order to promote CIRM-sponsored activities. Because I did not mean to leave it out.
Historically, as you all know, the relationships between CIRM and the federal government and the state government have resided with the vice chair of the board, and that the chair has served as to assist with those efforts. And I think that's what's reflected here, Steve.
Okay. Thank you. Thanks for those answers. I seem to have missed the number 10. Okay, thank you.
Yeah, no worries. Good. All right, and then Claudette, if you wanted to just continue scrolling down, I did pick up the skills and qualifications from those documents as well. And was there any harmonization done, or I think those are pretty much verbatim?
They are.
Okay, great. And then we did want to make sure that we included that there is six-year term for both the chair and the vice chair, and that they are subject to removal under specialized circumstances. And then, of course, we wanted to note who their direct reports were. And for the chair, it really is the president and CEO. And then the remaining part of this is just standard language. All right. Anything else on this one, or would you like to switch to the vice chair?
I think you're on a roll, Susan. We could go to the vice chair.
I have one more, just one more.
Oh, I'm sorry, Steve. I didn't see your hand.
Yeah, so there's if you can scroll up just slightly, there's working conditions at the end of the day. We just had a discussion about in the Moss Adams performance management review or their audit about remote working versus being on site. Are there any policies with regard to the chairman with regard to the amount of time that he needs to be on site in South San Francisco versus not? Is there anything fixed in that regard?
No, there isn't.
Okay. No, that answers the question. I'm, the question is whether they're out to be, but let's leave it there for now.
Maria?
I was just going to mention, Steve, both Vito and I come into the office mostly on Tuesdays and Wednesdays when others are in the office. Sometimes we have other meetings that preclude us. Tuesdays are definitely the day where, we make it to the office and we're there. He flies up from Los Angeles. JT's in the office at that time as well. And then that's where what we've committed to. As far as anything that's written in stone, like we must be there, there isn't. But if that's something that the board desires of us, I have no problem with making it, something that is put in writing.
Well, my thought is this, and I don't know exactly, Raphael, described the policy. And I don't know hard and fast the ideas of having people show up 2 days a week at South San Francisco, given there's some flexibility on what those 2 days are. But assuming, if one were to make the assumption that it's a relatively hard and fast rule, that that's a clear expectation, then I think you would have that same clear expectation not only of the president of the organization, but both the chairman and vice chairman, given that they are employees as well. So any comment?
Absolutely.
So maybe, this is Scott, Steve, maybe we could make an explicit reference to the work from home policy, and that would allow it to sort of be any adaptations in the policy would be incorporated automatically into the job description.
Yeah, that would be fine with me.
Yeah, that sounds good, Scott. Thank you.
Okay, great. Well, let's move on then to the vice chair job description. Thanks, Claudette. And as that's coming up, I'll just mention, I also had the opportunity to review Maria's remarks that she made to the ICOC when she was being considered for the role. And so I was able to get more information about the focus that the vice chair would have. And I talked to Maria as well. That helped me discern really some of the differences between the vice chair and the chair. So if you'd like to scroll down to where it shows key responsibilities, and you'll see that we focused on the accessibility and affordability working group, which is a significant effort by the vice chair. And also the diversity, equity, and inclusion efforts, in addition to the other things listed. I thought were important.
I think Maria, sorry, Susan, to interrupt. I think Maria's going to have a question about that after we get through this list.
Okay. And if you don't mind continuing to scroll down. And my guess is you probably have read this already, but if there's any item you'd like to talk about, please let us know. And if you could continue scrolling. Oh, we've got it. Kim has a question.
It's not really a question, it's just the editor and me. I think there's in point 7,
Yes.
it's not grammatically consistent. Providing oversight of, and should be establishing the policies for.
Thank you. All right, and then you'll see the skills and qualifications again, straight, same language out of the documents that I mentioned. And then at the bottom, the same concluding about the supervision. And in this role, the two roles that Maria supervises would be the Scott's role and also the executive assistant to the chair and vice chair. Only other difference. All right.
Okay. Thank you very much. Maria, did you want to raise a question about the DEA?
Yes.
DEI, sorry.
Yes, thank you. At the time of my nomination to this, to my current position, I was working internally with the team on DEI efforts. And I mentioned that I could I could bring that to the board and help coordinate DEI efforts led by the internal team and bring them to the board and establish some processes around that and be an interface with the team. If the board does not want me to do that, that is okay as well. I just wanted to just put that out there because there's nothing in the proposition that directly spells that out. But it is something that I was working on prior. So I just wanted to bring that up as if the board would like me to continue serving in that capacity, that's great. And if not, that's okay as well. So I'm here to serve.
Thanks, Maria. I think this is an important component. Steve, go ahead.
Yeah, so I'd like to understand a little bit better. This refers to the board's DEI efforts. And what's the extent? What's the what is encompassed in that? Because separately from that, I would think in the management of an organization, that would the DEI stuff would fall principally to the president and CEO, who would report to the chair, to the board about it. But it's their efforts throughout the organization. So I can understand the board's DEI efforts, regarding applicants, for example. That seems very straightforward. That's something that and that's what we do, right? We have DEI scores on applications that come, et cetera. So I've got that, but I'm just curious as to what people believe this refers to. Is how far down into the organization itself does this reach? Does this reach down into personnel that are being hired, for example? Is the board going to take ownership of that issue?
This was more along at the time, what was considered while we were undergoing, bringing in a consultant internally to review the GWG processes and things like that, that the board would also undergo its own DEI training, as well as other initiatives that they may want to take on in relation to the board specifically. So that's where this came from. Also, internally, oftentimes there are questions about, whether it's the rubric or the patient advocates who sit on the GWG as board members, as GWG members, but they're also board members, and understanding and coordinating efforts around that. Again, if this is something that we just want to make sure is just strictly an internal process that then comes to the board separately, it's fine to take this bullet point out.
No, I'm not suggesting you take it out. I'm just trying to understand where where the outer boundaries of the board's efforts are versus internal efforts that are overseen by management. I think it's always good to understand the difference between what a board does and what management does.
I agree.
Yeah, I would certainly say that the president and CEO is responsible for the operation and the selection, the hiring, the diversity there. And I believe that the way that's laid out here, it's really truly for the board. It's about the board and not about the operation of the organization. Yeah.
Appreciate that clarification. Good. Thank you.
Great. All right. So if you're comfortable with where we are there, Claudette, do you have access to the timeline?
Before we go to the timeline, I was wondering if we could have a motion to recommend approval of these job descriptions to the full board.
So moved.
Second.
Vito, you have your hand up. Did you have a question?
Yeah, I do, but it can certainly wait after the motion because it's open to discussion then, right?
It is now open for discussion to the committee members. Yes. We have a motion and a second.
Yes. Can we go back to the vice chair, the bullet points at the top? Okay, let's see which ones. Let's see. Yeah, bullet point number 2, take the lead on government relations, California legislature, executive branch. And Steve's comments made me take a look at this. And now can you go back to the chair, the equivalent bullet point for the chair? Yeah, if you'll notice here, there's, depending on how you define healthcare system, California public, there is no reference to either the legislative or executive branch of either state or federal government. And this really surprised me. I understand how we got to where we are historically. For the last 12 years, the vice chair has been a preeminent leader in state government and brought over a whole wealth of personal and institutional connections. And our present vice chair also came from government with her own connections. But I think what Steve pointed out is that's not what Prop 14 said. I'm not suggesting that we delete anything, but I'm thinking the subcommittee might add something to 10, even if it's as weak or as minimal as saying that the chair will assist the vice chair in those activities. Maria, do you have any issue with that?
No.
Steve?
Yeah, thank you for pointing all that out, because that's sort of at the heart of what I was asking questions about. So I go back to when we were, you weren't present, but when we were making the selection of who would be the chairman of this organization. And for me, anyway, one of the things that I took into account, and I think others did as well, is your long experience with the California government in healthcare related matters, and your connections in the government, and not just in the bond area, but more broadly than that. And I personally view that as a positive. I'm speaking only for myself at this point, but that experience with California government, which included both the legislature and, the governor's office or the administration, I thought was a significant positive. And so to find that, that particular reference, which is in Maria's, list of things, and to not have it in yours just seemed odd to me, both based on the language of Prop 14 on the one hand, and what I thought was an important attribute of yours on the other. So,
Are there other comments on this topic?
Yeah, it's Pat. So I'm okay if their language is assistant, but the challenge I see is to make sure that there's, the chair's responsibility about engaging with the healthcare system and the California public at large is enormous. That's a giant responsibility. And so I'm adding engagement with legislative components as well, to me seems excessive, and that the primary responsibility needs to, the primary responsibilities for each of these needs to be divided. In addition to which, the board chair has the primary responsibility for overseeing the president and CEO, which is also another enormous task. So I'm just reluctant to have, if it says assist the vice chair, I'm okay with that, but I don't think it should be any more extensive than that, to make sure that the major focus in terms of engaging with healthcare system, and in particular the California public, is the lead responsibilities for this item.
Thank you, Pat. Are there other comments? Vito, are you raising your hand?
Yes, Matt. Just respond to Pat's comment. Pat, I think that's fine. I think you said it very well. I'm very comfortable assisting Maria in this. For example, is it next week, Maria? No, I guess it's early in March that we are, both of us, going to the Capitol in Sacramento, and we have appointments lined up with 7 legislators, both in the Senate and Assembly. We're doing it together. Even if I didn't go, there certainly would have been collaborative meetings between the two of us on what that message or asks, if you will, would be. So that's fine. The same thing would happen if we had somebody in our sights to speak with in Washington, DC. So I'm comfortable with that, but a little uncomfortable when there's no reference to government relations writ large.
So I think we would amend the motion to include language that Pat described about assisting the vice chair with these government relations. Is that okay with you, Susan?
Yes, absolutely. I've made note of it.
Okay. Any other comments from Governance Subcommittee members that are on this Zoom? Is there any public comment?
And we're checking.
Thank you.
It doesn't appear to be any.
Okay, then we should, shall we call for a vote?
Yes, I'll take the roll. And we'll also include in updates when this comes to the board, the changes that Steve Gilsgard mentioned regarding conforming with the work from home policy.
Yes, indeed. Thank you.
Kim Barrett,
Aye.
Dan Bernal, George Blumenthal,
Yes.
Maria Bonneville,
Yes.
Anne Marie DeLiege, Linda Boxer, Elena Flowers,
Yes.
Judy Gasson,
Yes,
Vito Bassiani,
Yes.
Steve Gilsgard,
Yes.
Pat Levitt,
Yes,
Linda Mulkus. Linda, are you perhaps on mute? We go to Adriana Padilla.
Yes.
Just making sure our count is good. Okay, great. That motion carries 9-0.
terrific. Okay, Susan, on to the next item, which is the survey questions for the chair, please. Thank you.
Sure. Yes. In that case, Claudette, could you please bring up the chair's survey questions? And just to give you a quick overview for the survey questions, the goal was to make this meaningful and to streamline what had been done in the past when we did the president and CEO together. Back when we had done that, when we had 40 questions, we invited comment after every category. And instead, what you're going to see on these two, for the chair, this assessment is 18 questions. And rather than invite comments all the way through, at the end, I'm asking for 3 positive and 3 negatives, meaning, 3 applauses and 3 suggestions for improvement for each of them. For the vice chair, it's 15 questions. I formulated the questions from the job descriptions. So if there's a couple of changes we talked about here, if there's anything you want me to change on the assessment, certainly a good time to have dialogue on that. The point of this would be that we would ask individuals to complete the assessment, and we would invite some of the respondents to also do interviews, similar to what we had done with the president and CEO. The categories of who would complete the board chair assessment, we would ask the incumbent, Vito, to assess himself with the same questions. We would ask his direct reports, which in this case would be the interim president and CEO. We would ask, a category would be the board governance subcommittee, and then all other ICOC members and alternatives would be the final category. Included with the board governance subcommittee, we would ask the vice chair. And the reason that we would have these in 4 different groupings is so that we had an opportunity to compare. Assuming that the board governance subcommittee and the vice chair would have the most intimate working relationship and knowledge of the chairs. So that would be the exact same thing for the vice chair. So when we do Maria's, she would have an opportunity to complete her self-assessment. The board governance subcommittee and the board chair would be the second category of respondents. The third would be her direct reports. And then the fourth, the final, would be all other ICOC members and alternates. So that was just a heads up of who would be doing this. So if we wanted to, Claudette, if you wanted to go to the beginning, you'll see that I grouped the categories, the questions into categories. And so for the chair, there's 5 categories, starting with the leadership of the board. So actually running the board meetings, running the board operations. External representation is the second category. Fiscal oversight is the third. Communication is the fourth. And then compliance and public accountability is the fifth. So I don't know if you had an opportunity to go through these in detail, but I thought perhaps you'd want to point out any questions that you have. If it's helpful, we could go section by section.
I'll just make one comment, Susan, it's Pat.
Sure, Pat.
Part of the challenge of these surveys, particularly for board members, is the way in which they're going to be able to evaluate based on information that they receive.
Mm.
And so for some of these questions within the categories, and I was just speaking for myself, it's a real challenge
Mm.
if there's not some way of, and maybe it had to go into a job description, which we just voted on, is to provide regular updates within these categories to the board so that the board has a reference for being able to make judgments. And I think this issue came up with the with other surveys that have been done where it's a real challenge to figure out how to answer these, because the daily or the regular contact for board members is limited to the meetings, or if there's outreach from the board chair to members, and how many, we have 33 members now, and how many of those can be done. So
Mhm.
to me, the solution is something in which there would be regular reports within each of these domains to the board by the board chair. I don't know if that is in the job description. Maybe there's something about communicating regularly with the board about, or providing updates, et cetera. If that's there, then that's fine, and that's the mechanism. But I just wanted to call that out.
I think that's a fair point. It's educational in nature when the board sees what the expectations are of the individual, but by that point, they hadn't been paying attention or monitoring it unless you're feeding them the information all along. So I think it's a very fair point. Adriana, do you want to go ahead and share your thought?
Chime in. I had the same thoughts as Pat. Thank you, Pat. And maybe can we hear from our chair and vice chair about how they might be able to educate or share their successes in these areas, or what their plans are for the year that might help in defining this issue a little bit more thoroughly for us. I couldn't answer a lot of these areas because I didn't have information last time.
Fair point. Steve, did you want to add a point too?
Well, it kind of dovetails with what Adriana was just saying. So you indicated that we're going to ask both Vito and Maria to do self-evaluations, right?
Right.
Those self-evaluations need to, in my mind, these self-evaluations need to precede, i.e. come before the evaluation by the evaluators, the board members in this case, for example, so that we understand what they have or haven't done with regard to each of these. And this kind of gives, I mean, we can have these updates at the board meeting, but I think to have them all identified in, one sitting coming before our evaluation would be quite helpful. So I'm hoping the self-assessments are done before we're asking board members to do their own assessments.
It's a fair point. And then, Vito, did you want to add something too?
Sure. Let me follow up on what Steve just said. Yeah, Steve, I envision you all sitting down with this SurveyMonkey or whatever format it takes on the left side of the table, and on the right side, you've got Maria and my self-evaluation hand in hand. So of course, I would agree that it should go first, and that you should all have it and have read it before you start checking off boxes or assigning scores. Secondly, these criteria, Susan, you made I think it's a great list of questions. Could you, let's see, scroll, invites different opinions. Maybe it's 4.4. Appreciates the different. That one, and can you go up further just to refresh my memory here, because I'm looking at this. And maybe it's in the 2s. Okay. Keeps it. So here's a point. It's not an objection, but and I'd be happy to take Adriana's suggestion in reporting on all of these and other categories. There's just one problem. most of my communication with board members, and I've reached out to at least a dozen, and I'm going to say a handful on more than one occasion, and 2 or 3 of them 4 or 5 times each. And this is in spite of the fact that issues surrounding the last president, I feel, stole 3 months out of my year. But I approached these board members because I thought that they would, at subsequent board meetings, when a topic came up for discussion, that they were going to either be confused or be actively, don't take that the wrong way, or be actively in opposition to something that I felt strongly about, or that I felt a majority of the board was going to vote favorably on. So outreach to individual board members to understand better where they were coming from in their objection or their confusion on something. And this spans the whole gamut of things we've talked about. A lot of it to do with the Neuro Task Force and other initiatives. These are conversations that I would not want to report on in any way. I think I would be violating personal trust with board members. I think there's probably a way, in a quantitative way, to report, Adriana, to the board members and say, yeah, I reached out on the Neuro Task Force to 6 individual board members, not violating any Bagley-Keene issues, to understand better the remarks they made at the last board meeting. But that's the only proviso I would raise at this point, is a sort of confidential matter between the chair and individual board members.
Adriana, did you want to clarify?
Yeah, and that actually is helpful. I mean, I've been on, for instance, a community health center board, and the chair of the board would send out, I don't know if it was monthly, it's too much, but maybe quarterly accomplishments for the quarter, what you've accomplished in certain areas. And it can be very generic, but at least I know that, I had an idea of what was going on during the year, not just at a sit down at the end of the year. That's what I was referring to. Thank you.
I'd like to give Maria a chance to speak. Maria, go ahead.
Thanks. I think that part of our job is to make sure that things run smoothly and that things are going well, and that it does involve individual conversations with board members. That is not to say, however, that we cannot report back on the efforts we've made to and show examples of situations where perhaps there was confusion about a particular program, and that it helped to engage in conversations with board members. What I've tried to do is for different aspects, for example, for things with access and affordability, the board members who sit on that committee, when things are accomplished or when there are different milestones that are met, I reach out to them and let them know what is going on as members of that working group. I have no problem. I think it's a great idea to report back quarterly in whatever form the group would like about things that are going on in the organization, how we've moved things along, where things are in our different jobs, insofar as what our goals are and our accomplishments. So I think that if that's what works, I think that's great. Or an email or however the board would like to do that, so that it's more helpful when it's time to gather information for a review.
Thank you very much. Pat has his hand up.
Yeah, I was going to say, I mean, my comment wasn't meant to generate an inventory list of who the board chair and vice chair have spoken to. Like, I have to report back to who oversees me.
Yeah.
And he doesn't ask for a list of who I've met with. And so, look at question 1.4, score. Keep a pulse on what's happening in all subcommittees and working groups through periodic attendance at meetings and open dialogues with chairs, co-chair, and working group leads. How does anybody answer that if they don't know or get a sense whatever the time frame is in terms of reporting it, here's what we've been doing on various subcommittees. Effectively communicates the agency's strategic vision and strategy to a variety of external stakeholders. That's basically, okay, here's some of the stakeholders that we've been engaging with on such topics. The board needs to know that. The board I've only been, I don't know how long I've been on it. It seems like 100 years, but it's probably more like 2 or 3 years. But I can tell you that when I look at some of these questions, I can't answer them. And I'm on a lot of subcommittees, but I still can't answer them in relation to the work of the chair or the vice chair, because we just don't have that information. But it's not about a list of conversations and those sorts of things. It's about more of a gestalt of what's going on in each of these domains. And then I think, at least from my perspective, I could answer some of these questions, but some of these questions I literally could not answer because I would have the information, and using each of your evaluations of yourself provides some insight, but it doesn't necessarily provide the insight to be able to answer these questions. And I just don't want to do a survey for survey's sake, right? To do evaluation. It should be a evaluation that's meaningful for each of you in terms of getting feedback and feeling great about what you're doing. And then some areas in which the board feels that there's opportunities for additional investments of time.
Thank you, Pat. I think what Pat is, and a number of other people are saying, and Vito, I'll call on you in just a second, is that you have these 5 buckets here of different categories of activities, and whatever way you choose to pursue those, it would be really useful at a board meeting if you were just to briefly summarize what you were doing in any or all of them in terms of making progress with communication, for example, with the outside world. Vito?
Really just a question maybe for Scott. Sure, if I did this at a board meeting as part of the chair report, that's public knowledge. Scott, if I were to send this out as an email to all board members, that would be considered a public document?
That's correct.
That's fine.
That's fine,
That's
right?
fine. We're a public agency, so that's how it goes.
Yeah, it's informational. It's just it's informational. I think that's fine.
Okay. Good.
Any other comments on this survey? And if not, we'll go on to the vice chair. I don't see any hands, Susan.
Okay, Claudette, if we could have the vice chair. Thank you. And as you look at these questions, you'll see that they were drawn from the job description of the vice chair. And there's just 15 questions, and then the 3 pluses and 3 minuses, inviting comments at the end. And Steve, please.
Yeah, so I was looking at number 3.1, and it focuses simply on it's members that reflect strong public outreach and community communication, but really doesn't speak to. So this is the chairman of the AAWG, the person that's in charge. And I would think that we would want to add language that not only are these things, but that they are also knowledgeable and experienced in the areas of access and affordability. We want members who have that kind of grounding in addition to, or maybe even before, strong public outreach and community communication, because in Maria's case, if she has members that she's inherited that aren't knowledgeable, aren't actively making a difference, then it would seem to me that it's in her purview to release them as members and recruit new members.
Okay, so you would tighten that language to say not only reflect strong public outreach community communication, but strong knowledge experts at doing this.
Strong knowledge and expertise on access and affordability, very specific as to that knowledge and experience is.
Thank you, Steve.
Mhm. Great, and
Claudette, is there more to
More.
go? Yeah, there we go.
Okay, Steve, is your hand still raised or do you have another point?
Sorry, no, let me get rid of that.
Okay, Kim. Kim, you're on mute.
Sorry, all these years. How is it intended that 4.1 and 4.2 are different?
I probably misinterpreted, but I assume that there is an entity in Sacramento that there's a communication with a certain office holder, and perhaps there's not. Maybe it's meant to be more in general.
Maria?
Do you have a point of view, Maria, on that?
I would say that they're the same.
Okay, could certainly take out
If
4.2.
you mean Sacramento, like other things, for example, public health department, things like that, that may not be captured in the first one, you could keep it as, yes, Vito, you have your hand raised.
I would disagree. They're not the same thing.
That's where I was just headed.
Yeah,
as I was
Maria,
mentioning.
you have a lot of relationships with the constitutional officers that are not part of either legislative or executive branch of government. The treasurer's office, the controller's office, and things like that.
So I think we need to be more explicit then, otherwise board members won't know what this means. And I live in Sacramento.
It's you, Kim. They need to be
Kim
communicating more
Barrett.
with you. Yeah. So you would describe that as treasurer's office, or is there veto constitutional offices? What would be the correct term?
Right. What do you think, Maria? Constitutional officers?
Well, I don't know, because again, if what we're talking about are other public agencies that help further our mission, for example, Public Health Department, Office of Healthcare Affordability, things like that. That would be under.
Sorry, those are all part of the executive branch because they fall under the agency, Health and Human Services.
Okay.
I'm trying to think of. I don't know, Secretary of State. There might be occasion if you're going to talk about something on the ballot.
But doesn't that fall under the executive branch, Vito?
No, they're elected by all the citizens of the
true.
state.
Yeah.
Could we make it sort of vague and rather than trying to describe it, say something like keep other
state officials or
state officials as it would be helpful or useful, informed with the achievements, the opportunities, and the challenges.
Got it. Good.
Okay. Other comments on the vice chair's survey? Okay, I don't see any other comments. And so if we could have a motion to recommend approval with the changes that we've discussed of the survey of the chair and the vice chair to the full board.
So move.
Thank you, George.
Second.
Thank you, Steve, for second. Any additional discussion by members of the Governance Subcommittee on the Zoom? Is there any public comment? No, Claudette? Okay, in that case, I think we can call the roll.
Just as a point of clarification, Judy, for a second, where did we end up with 4.2? Just so I know how to implement the decision here. Was it keep the constitutional officers informed, or was the decision to
Susan, what did,
Yes,
Susan made a note.
Yes, what I jotted down was keep other state officials as other state officials, and it goes back to what we were saying before. Informed as needed on CERM's achievements, opportunities, and challenges.
Great.
So it's meant to capture anything outside of the executive branch.
Great. All right, Kim Barrett,
Aye.
George Blumenthal,
Yes.
Maria Bonneville,
Yes.
Elena Flowers,
Yes.
Judy Gasson,
Yes.
Vito Imbasciani,
Yes.
Steve Julesgaard,
Yes.
Pat Levitt,
Yes.
Linda Malkus.
Yes.
Thank you, Linda. Adriana Padilla.
Yes.
Thanks very much. Great. The motion carries 10-0.
Okay, item 5 on the agenda. Is there any public comment on any matter that we have discussed today or any other related matter? Any hands raised? No, Claudette? Thank you very much. Any last comments by any members of the Governance Subcommittee? If not, I believe that we are able to adjourn at this point.
Thank you, Susan.
Thanks, everyone.
Thank you so much, everyone.
With a big thank you to Susan.
Thanks,
and
Susan.
her team.
My pleasure.
Thanks.